Rocket in the sky, catch your eye, please don't cry, wait goodbye. I survived all them dark, cold nights. Star, I am bright, I don't die, I won't lie. I'm just trying to be the best I could be and achieve my dream.
Hello everybody and welcome to the Sober Stew podcast. My name's Stuart and you're listening to and watching an addiction recovery podcast. Today my guest, Wendy Ambrose, a different kind of guest. She's not in recovery. She works as a professional, as a counsellor, as a qualified psychotherapist, breathwork coach, and a clinical supervisor, and she's also accredited by the BACP. She's coming along today to discuss ADHD and addiction and what our opinions and views are on the link between the two. Wendy, welcome.
Thank you very much. Thank you.
How you doing?
I'm good, thank you. And that was a really grand opening and an introduction to me. Thank you. But as I'm sat here, I just want to bring in the room right here, right now. I'm not an expert. I'm just a counsellor who works a lot with clients with both ADHD, autism, addiction, and I see so many links between these three major subjects. And I suppose all I want to do is work with you to try to build more awareness. Yeah,
awareness, and this is it. And do you know what? I think, as we was just talking before we started recording, a year and a bit ago, when I had the realisation of my ADHD, I then done a lot of work on myself after that point, but it also answered a lot of questions on my life before of why I made certain decisions, relationships, why I might be so into something for the first 5 minutes, 2 hours, 2 months, and then it's like, bang, I'm gone. And it was like repetitive. But that was really dangerous, and it caused a lot of issues for me and other people.
Yeah.
So, you know, I've spoke to a lot of people in addiction on the Sober Stew podcast, on Instagram, and every person I've spoke to, I think it's every person I spoke to, have said they either have been diagnosed with ADHD or they believe they've got it. So I've sat there and I rattled my brain and I'm like, what's the link? Where does it come from? And you said earlier, it's like the chicken or the egg.
Yes, exactly. What's come first?
Yeah.
Have we been born with ADHD in our DNA? Is it a genetic factor?
Yeah.
Has it developed in our early childhood and adolescence as environmental impacts around us? Or have we been born with a physical propensity to develop addiction, and then because of the anxiety of the addiction, we've developed ADHD traits?
Yeah.
Now
that's a very good question.
I don't know how you'd even prove that, to be fair.
No, I don't know. And that's, God blimey, yeah. That's tricky, isn't it?
It is.
Because if I look back at my childhood, for example, I wouldn't have identified it as a typical ADHD child, I don't think. Although my mum might have had a different view on that, I don't know. I said that out loud, I was thinking then, maybe. But I do recall that my brain has always been like manic, busy. And that's part of ADHD, is that correct? Yeah.
Yes, most certainly.
Yeah.
Might be a good point if we just talk a little bit now.
Of what ADHD is? Yeah. Okay, so so tell me, what is it?
Well, when you asked me to come on and do this, I thought I better do some Googling so I know my facts. And it's believed it's a neurodevelopmental disorder.
Okay.
That causes us difficulties in staying focused, staying concentrated on any particular task, and then being able to control our impulses.
Yes, that sums me up.
Right.
Does that sum you up?
Most definitely, yes.
Right, okay, yeah.
I'm not clinically diagnosed with ADHD. I recognise so many traits about me that are similar to ADHD. Mine was that more typical in little girls, where a little girl in a classroom will stay very quiet because she wants to please the teacher.
Yeah.
Because as part of ADHD, we develop this increased sensitivity to rejection.
Right.
So what do? We grow up wanting to please everyone.
We'll
start with teachers and friends around us. We stay very quiet, so we go under the radar a lot. Whereas typically, a boy in a classroom setting is going to be more hyperactive, bouncing off the walls.
So why would the boy and the girl be so different?
I think a lot of that, certainly in the time when I was growing up, it was all about conditioning.
Okay.
How little boys should behave, how little girls should behave.
Yeah.
Now, possibly not so much.
Right.
And there'd be more of a crossover on both those sides.
Yeah, I get that. Yeah. And when you said to me then that some of the traits here, the symptoms, is the inability to keep attention,
yes.
right? I sat there and I was laughing to myself. I don't know if I've got that on camera. There's a little smile because, like, I will do podcasts as an example, and I'm sitting there talking to you, and I'm really interested in what you're saying. And then I can think about what I'm having for dinner.
Oh, yes.
And then I think, oh, fuck, what did you just say? Do you see what I mean? Yes. And I'll do that all day. Like, people think sometimes I'm being rude when they're talking to me. And I'm not being rude, genuinely not, because it's like, I don't want to be thinking about something else when you're sitting here talking to me, but that happens all the time.
Yes.
Does that happen to you as well? Because as a counsellor, that's got to be tricky.
Strangely enough, in the counselling room,
Yeah.
perhaps it's because I wear this professional persona, I can leave the ADHD brain outside the counselling door because I'm totally in tune. But then, now this is what I do. I will use my ability to hyper-focus, because that's another element of ADHD. I tap into that, the hyper-focus, to stay on my client and leave. Oh, look, there's a squirrel just outside the window. I leave that alone.
Yep.
But it took a lot of training, obviously, when I was training to be a counsellor, and I didn't understand then why I was finding it so difficult. But once I learnt this ability to just hyper-focus and to literally sort of block down everything and shut everything out, then that became
you're all right.
my go-to.
Good. Yeah. And the other thing you mentioned was, well, I don't know if you mentioned that then, but we spoke about it earlier, it's the inability to retain information sometimes.
Yeah.
Isn't it? That's hard.
It was once described to me, ADHD, it's like sitting in your living room and having about 10 different TV screens on the wall and watching 10 different TV programs. And to a certain extent, you can do it. But then someone introduces the 11th screen and then it all falls...
Bang's gone.
Apart, totally. And the sense of overwhelm is just unbearable.
It's painful.
Yeah, it's physically painful.
So what was the definition you got off Google again? Just so I'm putting that back into my head.
Yep, a neurodevelopmental disorder.
Okay.
Cool. And it's believed it's caused by either genetic factor.
Right.
It's part of your DNA that you'd have inherited from one, maybe both parents or grandparents, somewhere in your family line. Or it's through environmental impact. So
I think I've read that before.
Yeah. If you're born into perhaps a very chaotic situation.
That can lead to that.
That can lead to it.
So that wouldn't... So would that mean born with it or develop it?
Both.
Both?
Yeah. It's believed that when a woman is pregnant, during the 3rd trimester of her pregnancy, that's the time that the vagus nerve, which is the major part of your nervous system, not just yours, mine as well.
Yeah. I've never heard of that before, by the way. I'm sitting here now thinking, you're in knowledge. Blimey, I like this. Go on, carry on.
That vagus nerve has become myelinated, which means it just grows a protective sheath over that vagus nerve. Now, that vagus nerve runs from the base of your spine right the way up into the brainstem at the back of the neck.
Okay.
And the myelination, this protective sheath, this layer that it grows, that's a thing that starts to produce our emotional resilience.
Right.
Without it, we will have a propensity for high anxiety.
Okay.
Or depression.
Which I've had.
Right.
Yeah.
Now, of course, if mum is under extreme pressure and stress during that 3rd trimester of the pregnancy, then it already starts to affect the unborn child.
Right, I get you.
Then in the first year of baby's life, when this myelination process should still be happening, again, if there's a lot of chaos at that point, then it's just not happening naturally.
Right.
I've read a lot about inherited trauma. So I'm digressing, but that's obviously part of ADHD in the moment, but it just feels...
We can digress as much as we like, because that's going to happen, I think.
The pair of us, it's going to happen, Inherited trauma. There's been studies done that have proved that we will inherit trauma as part of our DNA. For example, the survivors of the Holocaust from the Second World War, they didn't speak about the atrocities that they went through.
No.
And yet their children, their grandchildren and great-grandchildren, a lot of them had the propensity to develop high anxiety or depression.
Wow, that's powerful, isn't it?
Yeah. Not because they experienced it because their fathers, mothers started to tell them stories of what they went through, but it was because during their incarceration, their chemical imbalances was shot to bits, literally, and they lost. They lost their protectiveness, they lost their emotional resilience, and their cortisol, their stress hormone, would have been so high.
Wow. And then that's passed on.
Yes, that's passed on in our DNA. It's complete lottery as to what we get.
Yeah. So I'm digressing in my brain now as well. Yeah. So when you're growing up as a child, you've been handed these deck of cards.
Yes.
Sometimes not even by your parents.
No.
That's mad, isn't it?
Isn't it?
Isn't it?
Now that's the bad news.
Yeah. Or could be good.
Or could be good, depending on what we get.
Yeah.
The good news is once we know what we've got,
yes,
we get on with the business of learning to live with it.
Yeah.
Establishing better coping strategies.
Yep.
Sometimes having to fight for ourselves to be noticed and heard, but finding a better quality of life.
Yeah, I agree. Yeah, and you just made me think because, like, I'm very proud to tell people that I'm a recovered addict. Yeah. Because without me recovering, I wouldn't be here. So that journey of recovery, I'm proud of.
Yeah.
But I'm also, I don't look, and when I looked at ADHD a year and a half ago and had that realisation that I suffer, and I look back at my life and the choices and decisions that I've made, and I think most of them, if not all of them, were linked to an ADHD way of thinking.
Yeah.
But I use ADHD now in a positive. I don't look at that as a negative. Someone online said to me before, he don't like the word disorder because it sounds negative.
Yes.
And I'm like, I get your point.
Yeah.
Because a disorder is like a negative connotation, isn't it?
Something is wrong.
Something is wrong. Whereas like, you know what, I embrace it. Yeah, it doesn't feel like a disorder to me.
No.
Does it you?
Not now.
Not now, no.
No, not now, because for the first time in my life, I've got clarity.
Yeah.
I understand why my childhood was so difficult and my adolescence and my early adulthood when I was transitioning from school into a workplace environment and then trying to hold down relationships. Now I've got clarity for it and I'm not a bit regretful.
No.
Because I wouldn't be who I am now.
Of course.
And I wouldn't be doing the job I do now if that hadn't been my life story.
So it's gratitude.
Yeah, gratitude, most definitely.
So let's go back a minute because when we were talking about the potential link to ADHD and addiction, you mentioned 3 things, didn't you? Is it 3 things? And then the last one you mentioned was that, I've got to try and get my brain around it now. Are you born with it and then become an addict? Are you an addict and then do you develop ADHD traits or whatever it might be? See, as a recovered addict myself, when I found alcohol, the easiest way to explain it, and I've heard it said 1,000 times, is you experience a feeling of ease and calm or ease and comfort. And it's like, do you see what I mean?
Yes, because alcohol is a depressant.
Yes.
So if the brain is running too fast, then alcohol is going to give it that...
that feeling. Yeah.
And that's what we chase.
Yeah.
It's not necessarily the taste of alcohol.
Never.
It's just that...
feeling.
It just feels a bit calmer. Same with cocaine.
Yeah.
To someone with ADHD, cocaine will calm the brain.
It did me.
rather than
it did me.
giving it that massive high.
Yeah, it made me want to just sit and chill. Like
Yes.
when some people used to say to me, like, they're all charged up and they're on, I'd look and I think, what are you talking about? What gear you got? That ain't what I've got.
No.
I used to do a line on that and I'd want to sit down and relax.
Yes.
Like, and I'd look at other people and I think, oh, you're off your head. But it used to calm me down.
Yeah.
But then made me really paranoid. But that's another situation for another story another
Yeah.
day.
Yeah.
But yeah, calming and the alcohol calming. But so then I want more of that feeling.
Of course you do.
Because maybe I don't like how my head is on a normal day-to-day basis.
Yeah.
But so it's a tricky one, isn't it?
It is, because what we haven't mentioned yet is dopamine.
Yes, very true. Okay.
Dopamine, this is a feel-good chemical. It gives us our sense of reward, pleasure, satisfaction, and it's responsible for motivation.
And you can get dopamine in so many different shapes and forms, yeah?
Yes.
Because I'm a little bit naive to dopamine. I hear people talking about it all the time, and maybe this is because I don't retain too much information on topics that I don't give too much attention to, if that's right. Do you know what I mean? So where can you get dopamine from?
There's both healthy means as well as unhealthy means.
Okay.
So you've already touched on the unhealthy stuff. The effect of the alcohol and the coke and nicotine.
Right. You get it from that as well?
What it does, it soothes the brain
right.
to such an extent that we believe we've found our dopamine rush because we are feeling that we can concentrate, we can apply ourselves, we suddenly found a bit of motivation.
Yeah.
But of course, they're the unhealthy friends. The healthy things to give us a dopamine rush will be in our diet.
Right.
A healthy diet.
Yep.
When people bang on about healthy body, healthy mind,
yeah.
This is the science behind it, because a lot of our neurotransmitters are all based in the gut. We call the gut the second brain.
Okay.
So a lot of all these neurotransmitters, things like dopamine, serotonin.
Yeah.
Very important for empathy.
Okay.
Both for yourself as well as other people.
As well, yeah.
Majority of that is all produced in the gut.
Really?
Yeah. So it stands to reason if you eat a healthy diet, largely natural sugars, avoid processed foods.
Yeah.
Then you're feeding your gut with the nutrients it needs to be able to create these healthy chemicals.
And if you feed yourself the opposite, you've got less empathy, basically, for yourself and others. Yeah,
you'll get a quicker fix. You know, if you've got to choose between, I don't know, a jam donut or a banana.
Yeah.
Tough one, isn't it?
Yeah, it's a tough one. It ain't really, no, but yeah, exactly. It is a tough one.
The jam donut is going to give you that,
ping,
very, very quickly, but it will be short-lived.
Yes.
The banana, you're not going to appreciate the effects of banana quickly, but it's going to build up in your system and it's going to have a longer-lasting effect for your energy and your natural sugars.
Yeah.
So, you can find dopamine in those healthy ways like diet, exercise, good sleep hygiene.
Okay.
Breath work.
Yeah.
Something we might touch upon as well. Meditation, mindfulness.
All that is
music.
Good. Okay.
These are all good things to start to develop.
Music as well,
dopamine.
Right, okay.
Happy music, music that's going to bring back a nice memory.
Right.
Okay, it's all there. So basically what I'm saying here is if you start talking to about 10 different professionals, a dietitian, a personal trainer, a yoga instructor, you're going to get a slightly different slant on all this. Yes. But it all comes down to the same thing. The more you can live a healthier, natural lifestyle and make better choices, then the better your dopamine levels will be, both in terms of their height, their quantity of dopamine in your body, as well as sustaining it.
Yes, sustaining it. This is the thing.
That's the key.
Yeah, it is the key, isn't it? Because then you're not looking for quick fixes. If you've got stuff, if something is there, you're not looking to change the way you feel, are you?
No.
Or not as much, maybe.
No, not at all.
Because if it's up there, bang, and it's gone again, you want to get back up again to some level, don't you?
Yes. And if we use the unhealthy coping strategies that send us up there quickly and we get a crashing low.
Would that be mobile phones as well and apps and all that? That's all that game, isn't it?
Yes.
Yeah.
Definitely.
That's dangerous then. I mean, that's another podcasting for another day. But my head's just gone on that tangent. It's like that's like I talk about addiction every single day, and it's always alcohol, cocaine, heroin, pills, whatever it might be. Last week I spoke to someone who's got eating disorders.
Yeah.
His addictive mindset about his eating disorders. Someone with gambling, but I never ever look at the smartphone and what it's doing to the world, and maybe that's something we look at another day.
Yeah. Well, that feeds into social isolation.
Yeah.
The more time we sit just staring at a screen and scrolling, the more we are withdrawing. Even though, now that's a tricky one because we believe, well, I'm getting a bit of connection here.
Yeah. You're not really though, are
but
you?
You're not.
No, you're not.
It's a false
It's
connection
lying
in
to
many
you.
cases.
It's like any other addiction.
Yes.
It lies to you.
Yeah.
It tells you it's all right because I'm talking to this one or this, that and the other, but it's a lie, isn't it? It's not real. It's not real. It's not like what we're doing here, sitting with each other day and chat, because that's socialisation, isn't it?
Yes, it is.
Yeah.
And that's something that people with ADHD will suffer with a lot, because if you're struggling to find motivation, you're struggling to apply yourself to something, you're struggling to concentrate or to maintain focus, then the effect of that on your mood is we start to feel less than.
Less than, yeah.
We feel...
So as a kid, I felt like that from as far back as I can remember, to the point where I thought that I was adopted into my family. My sister was the real child.
Yes.
My mum and dad don't know me. I used to get little bits of paper and write a sign saying for sale, about that big, and I used to put it in the front of the house, like on inside the street door, whatever it was, thinking that the house will get sold and I might then end up going back to my real family. That's how my head was. Totally didn't think that I fitted in. That's mad, isn't it?
Wow.
Yeah, and that's only just come back to me, as you mentioned that then.
Yeah.
That's like... Yeah, lack of self-worth, didn't fit in feeling. And that's a link to ADHD.
Most definitely.
Yeah.
Because we feel so less than. We see other people around us being able to cope with life so well.
So well.
Even though they might not be, but on the outside they appear to be coping so well that we keep looking inward and think, what's wrong with us? Why can't I do this? I'm lazy. I'm undisciplined.
Yeah.
I'm stupid.
Yeah.
But we're not.
No.
It's that just total inability to control an impulse that might be taking us off elsewhere, and to stay focused and find that level of concentration.
But you know what though? People do tell you you're lazy and you're stupid, because teachers and maybe parents, maybe other people would look at you a certain way. Yeah. And, like my school reports, I don't know what yours are like, but they'd be like, could do better, could try harder, could put more effort in. Yeah. Nice boy, but.
Yes, there's always a but.
Always a but.
Yes.
Do you know what I mean? And it's like, I'm not going to try no harder.
Yeah.
What you're telling me to do is boring. I don't want to do it. Yeah. And that's how I think my life is now, even. Like, if I've got a task to do, and I've had one task to do, and it's always in my mind, and it's a response to an email, and I've had it for 6 months, and I can't physically sit down and do it. I just don't know what it is. I think, I wake up in the morning sometimes, I go, right, I'm going to do that today. That is my challenge. And I get to the end of the day and I'm in bed and I'm like, I ain't done it. 6 months has gone past, you know what I mean? And I think I was like that at school.
Yeah.
Was you like that at school?
I had the opposite.
Okay.
I was so fearful of what might happen to me if I didn't do what I had to, that I over-focused on everything.
Did you?
Yes.
Oh, wow. So then you're running with a lot of fear.
Yes. And the amount of plates that I had spinning in the air from a very young age.
Chaotic in your head then. It's like...
Totally. And that wasn't just in school, because I was obviously an absolute pain to my parents that they threw me into everything going outside of school.
Because you couldn't sit still?
Because I couldn't sit still, no. And because I was obviously a very demanding child, they wanted me out the house. I don't blame them.
Yeah.
So I did everything. So I managed somehow, as young as I was, to do all these out of school clubs and events that they threw me into, and they were quite tough because you had to do achievements in each one. You know, I was a brownie and I couldn't just get one badge on my arm. I had to fill up the whole arm of all these proficiency badges. Yes, I had to do gymnastics and I had to do all the grades I could.
Right.
Same with dancing. Then it was guitar lessons, and then it was another musical instrument. You name it.
It's exhausting, isn't it?
Absolutely exhausting, and that was on top of going to a grammar school and having to be in the top sets of everything and achieving everything.
It's actually made me feel a bit sick listening to how that was, because my head's just gone, whoa, how did you do that?
I don't know.
I
It
generally
was my
can't
norm.
even comprehend that.
Yeah, it was my norm. And because I learned so well at how to do all this hyper-focusing on everything, that just became how I lived my life.
Okay, so I've got a question buzzing around in my head now then, because at the age of 14 for me, I found alcohol, and I keep saying alcohol and drugs. Drugs isn't alcohol. But anyway, alcohol is a drug, sorry. But I found alcohol and other substances, which quietened my head, but made me very unwell moving forward.
Yeah.
When you've got ADHD, and if you don't go down the route of addiction, what quietens your head? Nothing.
The thing that quietened my head was getting the well done.
So the praise.
Yes. Mine was all about...
But was that a short-lived dopamine fix?
Yes, because if I didn't come top of maths,
right,
and I was asked the question, oh, you came second? Who came first?
Yeah. Yeah. And who would ask that question? Your mum?
Yes.
So as soon as she asks that question, you're
Don't worry, she won't be watching this podcast.
So you're thinking you ain't good enough as soon as she asks that question?
Yeah, because I didn't come top. I came second.
And that pressure was put on, do you think, predominantly by your mum, or do you think most of it by yourself? Or a bit of both? It
started with my mum.
Yeah.
Most definitely, because of her demons.
Yeah.
But then, because I got a taste for achieving and getting that well done...
That's your addiction.
That was my addiction.
That's your addiction.
Yes.
Right.
Yeah.
There you go then, yeah. Hello guys. Hope you're enjoying this week's episode. Just a quick break here. I want to ask you a big favour. If you are enjoying the show, enjoying the episode, enjoying the podcast, can you please subscribe, please like, please share. I just want to let you know how important that is. The bigger this channel gets, the more people that see it, means that we can affect people's sobriety in a positive way, their addiction recovery. We might change a life, we might save a life. Enjoy the rest of the episode. Thank you.
And it's a subtle one, because it's not so much, people pleasing and pushing yourself all the time and being a workaholic. Mm-hmm. They don't seem as dangerous.
But they are, aren't they?
But they are.
Because, as a counsellor and as a psychotherapist, your clients, you must have people come in who are workaholics, who are in burnout.
Yes.
And
yes,
what they're doing is the same thing as what an addict would do with a substance. You're damaging yourself, aren't you?
Totally. Yeah. And it's very subtle, because people don't see you. They don't see the same behaviours they would in a drug addict.
Yeah, it's different. Yeah.
Or an alcoholic.
Yeah.
And it's very justifiable, isn't it? Well,
of course.
I'm working all these hours because I'm going from promotion, or because I've got to pay the bills, or because I want a nice holiday
Society
this year.
tells you when you've got to work hard, doesn't it? Everyone tells you you've got to work hard to achieve. You've got to work hard, you've got to work hard, you've got to work hard. So when you've got that mindset, like you were just saying that you had as a young child at school, then you want to come top.
Yes.
If that carries on then in a professional world, you end up being a workaholic.
Yeah.
Did you become a workaholic?
Yes.
Yeah.
And this is because I've done many other things before becoming a counsellor, but this is my healthiest profession
ever
of my life.
Ever, yeah.
Because I understand myself better than I ever did. I've also got to keep my eye on myself with my work-life balance, because otherwise I'm not safe to work with clients.
Yeah.
And I have to attend clinical supervision every month. So my supervisor will call me out if I'm suddenly seeing too many clients in 1 week.
Yeah, so your wellness is top of the agenda.
Yes.
Because if you ain't well, you can't help no one else.
No.
Yeah. So this is by far the healthiest profession you've ever had.
Yes, because I feel that it's the only one where I've been able to truly self-police.
Yeah, I get that. And
as well as having my supervisor being that other level of not being able to hide from someone.
And then I'm assuming that your ADHD has been more manageable and under control since you've been a counsellor.
Yes.
Every year that goes past, it's easier to deal with or manageable or whatever that feeling is.
Yes.
What is that feeling? How do you word that? I don't even know how to word that. It's like, is it manageable or is it embracing?
Maybe mixed with both.
Maybe.
Yeah. And for me, this is, I want to use the word delicious. I'm actually about to lick my lips as I say delicious because I'm in a career path now where there are so many different avenues I can go down in terms of other theoretical models I could study, other qualifications I can do. I'm self-employed, so I run my own diary.
Yeah.
I really am in control of me, myself, and I.
Yep.
But it's something that I truly believe I will never get bored of, because that's been one of my problems.
And that's exactly what I was just about to say. So when you're working with something, like when I'm doing these podcasts, right? You know, someone said to me the other day, because they know me, like so many people know me, I've moved house 17 times in 17 years, I think it is, as an example, right? So this is me, this is my life. Yeah. And I'll start something and they go, oh, you've not got bored with that yet? You ain't doing something else yet? And sometimes I think, well, why don't you like do one, do you know what I mean? But this was before I realised I got ADHD. So I start this podcast and I'm amazed at myself that I've not gone, oh, I've had enough already. You know, like I think we've uploaded 8 or 9 episodes. I've got another couple. We've got this one. I've got others. Obviously, I'm booked up till May, June with guys coming on. Yeah, it's like at least 1 a week, maybe 2 a week. So I look forward to it every week. Yeah. So there is no boredom. This isn't normal for me. It ain't normal. Do you know what I mean? There isn't ever a point where I'd be done by now.
Yeah.
But you've got that in your profession. Yes. And how long have you been doing your profession?
In total, including training, 10 years.
There you go. Like, that's mad then, isn't it?
It is.
You never get bored?
No.
Never?
Never. And actually, that's interesting because I've just made a link with something with myself. If I feel I'm getting stale...
Yeah. You do a course?
I do a course.
You do a course?
Yes.
So you progress, you learn more.
Yeah.
More knowledge.
Yes.
But in a field that you're interested in.
Yes, and because I've got a passion for it, I'm not looking for that external. Oh, well done, Wendy.
No, you don't need it.
No, I don't need it because it's coming from me.
Right. Yeah, I get that. I do get that. Yeah. And I think, so this is how my head then works. So you've been doing it for 10 years. So then the more you do it and the more you're working with others, your self-belief and self-confidence rises, doesn't it?
Yes.
You don't need that affirmation from someone else anymore because you're seeing it when you're sitting there working with someone, when all the pennies are dropping week after week.
Yes.
That's your affirmation, isn't it?
Exactly.
Yeah.
Yeah.
So that's positive.
It is. And I have to then rein myself in when I'm working with a client who cannot even grasp that place is available for them.
Yeah, that's hard. That must be hard.
Yeah, because I can't say, I know how you feel.
No.
Because I don't know how anybody else feels,
No.
number one. And number two, whilst I'm talking about myself here, I don't self-disclose in my client work.
Yeah, of course. Yeah,
because it's not about me.
No, and you could easily go off on a tangent with that one, couldn't you?
Yes.
So that's tricky.
Yeah.
And I'd find it hard. You're sitting there, and that's someone who's really unwell, isn't it? Who can't see that place as even a possibility.
Yeah. And this is quite sad, I think, because sometimes I believe that therapy, that the whole concept of therapy stops someone with ADHD coming in the room.
Right.
Because they might be carrying too much shame. Yep. Their self-esteem's on the floor. They've got no confidence. They truly believe no one's going to feel like I feel, which actually is true.
Yeah.
But therapy itself is a block for them to even come in the room to start with.
Yeah.
Because...
Yeah, the low self-esteem stops that.
Yes.
Yeah.
And then
and you're worried about someone they're going to judge you. They're going to judge you like you thought all your life.
Yes.
So you put the facade on. That's why you don't go and talk to no one, because you live a lie.
Exactly. And that's why I think that, or it's been proven that sometimes the group therapy sessions can be really difficult for someone with ADHD, because then it's just magnified.
Yeah, and do you know what? You've hit the nail on the head. When I started this community project, and we started with a group session for addicts in addiction, people found it too tough.
Yeah.
It was too hard, and I didn't understand why. But that was the reason why. It's very difficult.
What were the common things they were saying? Can you remember?
I feel like, I don't know if there was a lot of honesty coming from it, but I feel like not cross-sharing, maybe it's cross-sharing, maybe it's a case of being open and honest and calling people out.
Yes.
Didn't go down well. For me, because I've gone through the process of recovery, I embrace that, because if you used to sit there and say to me, hold on a minute, Stu, maybe this or maybe that, I go, oh, yeah.
You see it as a learning.
I see it as a learning.
Even better if.
Exactly.
Yes.
But when you're back in early recovery and you've still got that wall up or that facade or whatever it might be, and then you're calling me out there, and I'm a bit like, whoa, I ain't coming back here. Like, what's all this about? Why are you having a go at me? Like, it's that denial, is it? I don't know. A little bit. But I don't think it works. Now I'm thinking, when people are in a treatment centre and they're sitting in group therapy, I wonder how they feel when they're there. But they're having counselling as well in that treatment centre. One-to-one counselling and group therapy. So maybe that's how it works, because it's a different model.
Yes. And my hope is that in their individual therapy, they're feeling a sense to, I don't know, start just to speak out for themselves.
And being
that
encouraged
courage
to talk in the group.
Yes.
Yeah, I think that might be the case.
Yeah.
So I'm just sitting here thinking, as a kid, I know I had ADHD.
Yeah.
I then become addicted to substances. But I feel like I had a realisation a few weeks back, or maybe a couple of months back, that my first substance I got addicted to was gripe water. Do you remember gripe water?
Gosh, yes.
Right, so I don't know where it come about, but it come up in my mind. I thought, I remember that gripe water. I used to love the taste of it. I thought, right, I've got to look into it. I don't know if there's anything here, right? So I started researching it, and it blew me fucking away. It was like the amount of alcohol that was in gripe water was colossal. Like on another level. Guys, Google it or whatever, because they stopped, in America and in the UK, they stopped producing it the way they were producing it, because it was like a spoonful, it was like a little shot of whatever it might have been. Now, as a toddler, I remember having it on a spoon from my mum. I can remember the taste now. I can picture myself standing there in the kitchen with my mouth open, waiting for it. And I could feel it, like, going down. And I wanted more as a toddler. Maybe that quietened me down.
Oh my goodness.
Do you know what I mean?
Yes.
Maybe that did. I think it did quieten me down. Always
it would have. Yes.
It would have quietened me down.
Definitely.
So there was my feeling of ease and content from a toddler from that substance. So when I got to 14 and then I started drinking, it took me back there, didn't it?
Back there, yes.
It took me back there, yeah. So I become addicted very quickly.
My goodness.
That's mad, isn't it? I know.
I didn't know that.
Yeah.
I didn't know that alcohol was in gripe water.
Do you remember gripe water?
I do. Yeah.
Did you used to have it as a kid?
Yeah, my mum used to give me gripe water. My uncle used to give my cousin a shot of brandy in the last bottle of the night time.
Yeah.
Because it was accepted.
It was accepted, wasn't it?
Yeah.
Did your cousin turn out all right?
She did actually, but then he was a publican, so she grew up with alcohol.
Yeah, so sometimes
and
you don't want it.
she learned how to respect it because it was introduced at such an early age that it was never a treat or a taboo.
A taboo.
Yeah, that's it. It was never a taboo.
But you just hit the nail on the head there. You said that she learned to respect it.
Yeah.
And to respect something is important, yeah. I never respected alcohol. I never respected how powerful it was. I never knew what it could do to me mentally and physically. I never respected it at all. It's like horses, right? I'll have a laugh with my 4-year-old daughter. She says to me, don't worry, Daddy, you don't need to be scared of horses. but I am a little bit. I don't like them. I like them, but don't like them.
Yeah.
And I say to her, no, I respect them. They're big, they're powerful, and I have to keep my distance.
Yes.
She's 4, she's a toddler, and she'll jump all over their backs and she'll get off them. Fearless and ride them. But I respect them, but I never respected alcohol. No. Never. Just wanted it.
Yeah.
So I'm sitting here thinking that ADHD was there first, and then alcohol and other substances helped me cope with it.
Yes, because it would have numbed it down a bit, quietened the brain. Yeah,
but the big question is that if you're talking to another addict out there, do they all suffer from the symptoms of ADHD? You know, from your experience working with people who come in as an addict or talk to you as an addict, you know, it's hard for you to obviously look at people and make decisions in it. But can you see ADHD traits in addicts as a whole?
Yes, as a whole.
As a whole.
Remember, as us counsellors, we're not qualified to diagnose.
No.
But we can't help but pick up traits and similarities.
Especially if you've got it yourself.
Yes.
Because that's even more clearer.
Yeah. We make a connection, but then, or certainly the way I work is, as soon as I make a connection, I then remove that connection because it's not about me and I don't want to get it wrong.
Mm-hmm.
The thing I find most when working with addicts is there's a void.
Yeah, big void.
Yes.
Mm-hmm.
And is that void partly due to a lack of dopamine in the brain, which has led to ADHD? Very possibly, yes.
Okay, yeah.
You know, and everyone's story is going to be different.
And can that void feel like a hole in the soul?
Wow.
Because that's the way I used to think about it.
Really?
Yeah. That's how, that is that. Like a friend of mine used to say, it's like somebody, you know, trying to put a little sticky plaster on a gaping fucking wound.
Yes.
Do you know what I mean? Ain't doing nothing. That's like,
no.
And that void for me, it felt like a hole in the soul. It's the only way to explain it, really. Like, it felt nothingness, like just dead inside.
Yeah.
That's a lack of dopamine, potentially.
Potentially, yes.
Yeah.
And if you think about that, you can begin to understand why people don't want to come into therapy, because if their void feels like that, a gaping hole in their very soul, then what good is it going to do just talking about it?
Well, this is it.
That's where a person often starts.
Yeah, that's where the person, what's the point?
What's the point? It's only going to make me feel that void
even more,
yes. It's only going to exaggerate it more. So why on earth am I going to go into a therapy room and talk in front of a complete stranger about this?
Yeah. But what would your response be to that?
Well, we are verbal processors.
Yeah.
Us humans, we are verbal processors. And each and every one of us has got a story to tell. Each and every one of us. And when you come into a counselling room, you're not going to be interrupted. You're not going to be told, no, that's not how you feel.
Which you would be by your friends and your partners.
Exactly.
And your family.
Yes.
Yeah.
It's quite the opposite.
Mm-hmm.
You know, we are your silent observers.
Yeah.
To just hold you, create that safe space that's confidential, to just give you the time and space to start to talk it out.
Yep.
And it's in the talking it out that we begin to make sense of our own story.
Yes.
Because how many times have you started to explain something to someone and halfway through what you're saying, you say, oh, no, that's not what I mean.
Yeah. Or somebody like me, that I'll do it a lot, will interrupt or interject, and then you would then might go off on a different tangent and you ain't finished what you was trying to say.
Exactly.
All the time.
Yeah. And one of the things I've learned with working with people with ADHD is I've got to really time it carefully when I make my interventions, because if I go in too soon, I can almost see the physical pain I've caused my client.
Oh, what to go off?
By stopping them. Because what they've done, they've started on their story and they've got to say it, and as they're talking, they are lining it all up in their head.
Yeah.
And it all makes perfect sense. If I suddenly come through and slice through that...
That's painful, yeah.
Oh, yes.
Yeah. It's uncomfortable.
Yes.
Because, Listen, I'll tell you what, you just reminded me of something. So if I used to be in the office, right, and I'd sit there and I'd go, right, I've got to write this email to someone, get your emails open or whatever, to whether it was PA or secretary or office assistant, and I'd read it, bang, out of my head. And then she might go to me, hold on, can you read them? I say, I can't read it again. I can't read that again. Go, why? I said, because I can't fucking remember it. Yeah. I'm done. That's it. That's your job now. I'm gone. Because it was profound when I said it, but I can't remember a word of it. Like I've just said 10, 15 seconds ago. Keep up, please. Yes. And that's how I'd be. And then I'm out the door. Yes. And if you stop me or someone stops you in mid-flow like that, that's what would happen.
Yes. It hurts.
It hurts.
Yes. And the frustration that it causes us.
Yeah. Yeah, it's very frustrating.
Yes. And if that happens too much in your life with friends, family, professionals even, then we stop telling our story and we start biting our tongue and we start holding it all within because we see people's eyes roll and when we start talking about something and we see them go, oh, okay, how long is she going to go on for?
Yeah.
And then that again makes us feel less than. So
it does,
we go quiet, we bottle it up.
That's painful.
It is.
I know. I'm just sitting here thinking, I own that truth. I'll do that to some. I can get like that now because I'm like, go on in, get to the juicy bit. Like, come on, tell me where you was, and I'll be like, I'll be a bit like that sometimes because that's when I'm not checking myself.
When you're not checking yourself.
That's when I'm not checking myself and I'm letting my impatience and my ADHD run ragged because it's like, come just get to the point where you're trying to tell me. And that person might be struggling to get to the point or they're taking a long time because they're giving me quite a bit of information to go with it.
Yes.
And sometimes I don't want to hear that bit. That's my truth. I want to hear the end bit.
You do. But it's so important for the person telling it to share all those bits of information because if they don't, then they beat themselves up for not having given you the whole story. It's almost as if they've lied. That's certainly how I felt in the past. If I don't tell someone everything, by not telling them everything, I've concealed something.
Okay, that makes sense. Do you know what I said this to you right at the beginning of the podcast before we start recording. Every single podcast, I learn something, and I've learned a couple bits today. But that is one thing that I'll really keep in my locker because I'm replaying a couple of conversations recently where I've been like that, and I'm not then thinking how that person's feeling when they're talking to me, and that's not nice. No. So I'm keeping that one in my locker because, that's my issue. You know, I'm rushing them along or rolling my eyes. It was like, fucking hell, come on. Do you know what I mean? That's how I feel sometimes. You know, if I've got to go and do something or I'm thinking about doing something. Or I'm thinking, I've got to text Wendy, right? I've got to text Wendy. And someone comes out and wants to tell me something. I'm planning what I'm saying to you on that text. Then you're talking to me. I'm like, oh shit, I'm in the right pickle now. I can't then go, okay, put your phone down, leave that text for a minute. Sometimes I'm a little bit like, go on, quick, what you saying? Yes. I feel overwhelmed.
Yes.
Over those two little simple tasks. Listening and then sending a 3-line message.
Yeah.
But I can feel overwhelmed with that.
Yeah.
And then untreated ADHD, when I say untreated, I'm not talking about ADHD medication. I'm talking about, for me, and we will touch on it, is that over the last 12 months, I've used a lot of breath work, basic breath work. But for me, that's treated my ADHD, along with me being aware that I've got it, has helped it also. But when you're running with untreated ADHD, it's got to be so overwhelming and very tiring every freaking day. Yes. Because that's how I feel when I let it run away.
Yeah. It can actually feel demobilising.
Very. Yeah. Yeah, very.
Yeah.
And I know breathwork's a massive topic, but I want to ask you, why is it that when I started using basic breathwork and it's just in through the nose and out through the mouth, but I do it, I've trained myself. It's been really hard. I'm not going to lie. So hard, but I do it now. I'm going to say 50% of my waking day, there or thereabouts, which I think is massive. You know? And like yesterday, you know, going to hospitals with my little daughter and this, and knowing that it's going to be a very emotionally stressful day, my breath work, I don't feel anxiety no more. No. It's took it away. That can only be the breath work. Why?
Right, okay, there's tons of science behind this, and I'll try and summarise it so that I don't go off on too much of a tangent. Before modern medicine, us humans had to find a way to regulate our emotions.
Okay.
Because anxiety's been around us, since we evolved, forever. And what happens is when we go into a state of anxiety, let me start the other way around. 80% of the messages in our brain comes from our body.
Okay.
Not the other way around.
Not the brain.
No.
Right.
So 80% of the messages in our brain come from our body. So if we start altering our breathing pattern, we are sending messages to the brain that could be potentially he or she's in danger.
Okay.
So for example, if you start breathing short and shallow, so if these were your lungs, right, and they're just pulsing like that, very short, shallow breaths, then the message goes to the brain of, well, she must be in danger because she's not even taking in enough oxygen.
Right.
So that's danger number one.
Okay.
She's not taking in enough oxygen for us. So we are now in a state of danger. What's causing the danger? And so the brain's job is to go off and find what the danger is. Now, very valid if you stepped off a curb in front of a double-decker bus and your lungs start breathing like that because you realise what you've done. Yeah, a double-decker bus could potentially kill you. Yes. But it's not helpful if we start doing that and you're going into a hospital environment.
Yeah.
Because that's not going to kill you.
No.
You might not like what you're going to hear, but it's not going to be a threat to your life.
It's not a double-decker bus, is it?
No, it's not.
It's something you're definitely going to get over.
Yes.
Yeah.
Same as doing a podcast.
Yeah, exactly. Yeah, 100%.
If your lungs are doing that, then you're giving the message to the brain that,
we've got a big problem.
Exactly. The moment you start to breathe slower and deeper so that the lungs can expand fully and deflate fully, then a number of things start happening. First of all, you're taking in the right volume of oxygen, meaning that the bit of oxygen that does get to your brain with every inhalation is getting to the front cortex.
Okay.
And this prefrontal cortex of the brain is responsible for truth, fact, logic, and evidence.
Okay, right, yeah.
Truth, fact, logic, and evidence, okay?
Which is important when you suffer from ADHD then, isn't it? Yeah. Okay.
Yeah, important for everyone.
For everyone, yeah.
Because without enough oxygen getting to that part of the brain, then the part of the brain that does work in overdrive is your emotive brain, the bit responsible for your emotions and feelings and thoughts.
So your anxiety will be through the roof.
Yes. And that's like your internal smoke alarm that sends off the anxiety message.
Yeah.
Okay? So, once your lungs start inhaling and exhaling to the right volume, then you start to bring down the busy brain, the brain waves, because you stop functioning from your emotive brain and you start functioning from your rational brain.
Mm-hmm.
Other things will happen physiologically. Your heart rate starts to slow.
Right.
And gets into a more soothing, calmer rhythm.
Yeah.
Your blood pressure will reduce. And even your digestive system will start functioning correctly. Really? Yeah. So those...
All from breath work?
All from breath work.
Basic breath work. So the basic, what I'll do in through the nose, out through the mouth, that improves? All
of that improves because those four major organs, your brain, your heart, your lungs, and your digestive system are working in harmony. It's called a balancing breath.
Yeah.
5 seconds in, preferably through the nose, 5 seconds out, through your nose or your mouth, whichever you feel most comfortable with. And scientifically it's been proven if you can do this for 5 minutes, then that brings your body's natural state of relaxation.
Okay.
And it is bliss.
Yeah, it's mad.
It's beautiful.
So would that be why But going into a setting yesterday, I went into with my little girl.
Yeah.
Normally, I feel like I would have built it up for days before, not eating, because the anxiety would have been there. Had a real bad belly, you know, like the anxiety belly, I used to call it, you know, and struggled mentally badly, you know. I'm just feeling that feeling now from before.
Yes.
But this time round, I've eaten right up until the day that we went to the hospital. I was eating that day, which is, to me, blows me mind, you know, because that's not heard of. As much as I didn't want to go and felt maybe a little bit of apprehension, I'm breathing all day still. I'm not having them feelings that you was just mentioning. It's not bliss, but it's calm. I was calm when I was there. Bliss is enjoyable. So it wasn't an enjoyable day, but I was calm.
Setting,
but I was calm,
you were calm.
which is bliss.
Yeah.
For me, that's bliss, isn't it, really? I suppose.
Yeah.
And now I've said it out loud, it is bliss compared to how I would have been. You know, when my daughter was in hospital a year ago and she was in for a period of time, I'd only just started doing breath work. I was a month in. I felt terrible compared to how I felt yesterday.
Wow.
Terrible. Like the difference is chalk and cheese.
Yeah.
And it can only be down to breath work.
Yeah.
It can only be down to breath work.
You've learned through breath work how to regulate your emotions.
Yeah. Is that what it is?
Simple as.
Right.
Yes. Because in that exercise you're doing, your logical brain is being able to talk to your emotional brain.
Makes sense.
As much as the emotional brain might say, oh, this is going to be horrible. Yeah, but we're going to be all right.
You're going to be right.
We've got to do this.
Yeah.
You know?
Yeah.
My daughter can't do it for herself.
Yeah.
She needs me. I've got to step up. Yeah, but what if they give us bad news? Whoa, hang on a minute.
We deal with now.
We deal with it. We deal with it when we know.
Yeah, exactly. That's
but we're going to be okay.
Yeah.
And I'm not going to help the situation if I let my anxiety go off the scale.
No, and when you can become over anxious as well, you can feel like you're going to pass out.
Well, yeah.
You can pass out, I'm assuming.
You can, yeah. Because actually this is physiologically your body doing its job, because it goes back to basic survival techniques, you know, when we were, cavemen and women, and we had to literally be looking over our shoulder every minute of the day. You know, because anxiety is there to send us into flight or fight.
Okay.
So to either run from danger, that's our go-to, that's our first position.
Yep.
Run away from danger. If we can't run, we want to fight it.
Yes.
So that's anxiety. And that's where we get very, very vigilant and the lungs are moving in short, shallow bursts.
Yeah.
Okay? And we need that to happen in a way if we're going to run from a saber-toothed tiger, because we
in Gravesend,
yeah. Because you need your heart to pump faster, because it will then pump blood round to all your extremities. It warms up your muscles.
Yep.
Your digestive system's got to shut down, because the last thing you want is to go and eat something when you need to be lighter.
Yeah, to get
and
away.
Run from danger. Yeah.
And that's why your bowels then get opened.
Exactly.
Through anxiety.
Yes.
The anxiety belly I was just talking about. Yeah, that's
definitely,
right.
because it's lightening your load.
To go.
Preparing you, to run from danger or fight and be more agile.
Wow.
Okay, so that's flight and fight, and that sits in anxiety. Depression is all about when we freeze. Okay. So this again is a irregular way of breathing, where we might breathe out.
Yeah.
And just forget to breathe in again.
Yeah.
Until suddenly we realise.
Yeah.
Oh.
Wow.
Yeah. Or we hold our breath.
Yep. You don't realise you're holding it.
No. And that sends the body into a frozen state, and that's where depression lives.
Is that where that lives?
Yeah, that's where we disconnect from our emotions. We numb out. We zone out. It's like the equivalent of playing dead.
Yeah.
Ever as a kid, watch a scary movie and think, oh, if they were trying to find me, I'd just lie down and play dead. And they'd come round and kick me, and I wouldn't move a muscle, and they'd walk on by and they'd leave me alone. And then I could run away once.
And that's that feeling,
they'd gone.
It?
Yeah.
And then if you continue that, that's a dark place to be, isn't it?
Yeah, it is.
Yeah.
But all of this, when we develop these irregular breathing patterns, it's short and shallow that sends into anxiety, or this holding our breath or breathing out and not breathing in again regularly enough. This is all sending messages to the brain constantly that we're not safe.
It's bad health, isn't it?
It is.
Bad mental health and physical health.
Yes. The reason you've been able to eat is because through your balancing breathing, this regular inhalation, exhalation, keeping it going all the time, is because your lower ribs are attached to your diaphragm, which is a great big parachute muscle that sits over your digestive system.
Right.
So the lungs move in 3 ways. As they inhale properly and expand, they move up slightly, so you feel a little bit of movement in the collarbone area. The lungs move out to the side, but also importantly, they push down on your lower ribs, which in turn push your diaphragm down, which gives your digestive system a good old boot.
Right.
And wakes it up.
Yeah, got you.
So then, with every inhalation, as you're inhaling properly and the lungs are expanding as full as they can, your digestive system is getting that boot.
Yeah.
And then it wakes up and your bowels start working.
As they should.
As they should. Because without that happening, so when we're just doing short and shallow breathing or just freezing, your digestive system goes to sleep.
Right.
And that's what will cause things like IBS, irritable bowel syndrome, and all the spasms that we get in the bowel.
Jeez. That's powerful, isn't it? All from simple. And, okay, so here's the question. Back in the day, you mentioned when you're cavemen, cave women, we breathed, well, was that the right word? Normally.
Yeah.
To a level.
To a level.
Because we've learned to breathe unhealthily.
Yes.
That is fucked up.
Isn't it?
Isn't it?
Yes.
And okay, so there's another question, right then. So you know this. I'm assuming healthcare professionals know this, right? So when you go to see a doctor, for example, do they ever recommend people to go on a breathwork course?
I haven't heard this so far.
No, I've not heard this
either.
Why would that be, do you think? Should we have another podcast about that?
We could do another podcast.
That's bad, isn't it? Because you've just explained all the health benefits from simply breathing correctly. Yeah? But it's not promoted.
No. There's a wonderful book, and I'd love to give it a plug, by an author called James Nestor, and it's called Breath. And the strapline was The Science of a Lost Art.
Okay.
The Science of a Lost Art. And that's what this is.
That's what it is.
It's a great book. He's a journalist by profession, and he took part in an experiment personally where he had his sinuses blocked for about 10 days, so he could only mouth breathe.
Right, okay.
And all that he experienced physiologically and mentally by not being able to use the nose.
Not good.
No. Because of that, he became really curious about breathing and the power of it, that he's gone off and he's researched it in so many different avenues and stuff. Fascinating.
Okay.
It's an easy read because he's passionate about it.
Yeah.
So it's not like reading a textbook at all. Well, that wasn't, my experience of it at all.
You enjoyed it.
Really enjoyed it.
Well, I will put a link in the comments or in the description at the bottom of this of that book as well. Okay, so I've got one last question.
Yeah.
So have we decided that there is a link between ADHD and addiction, do you think? Do you think there's a decision on that? A potential decision? Do you think there's definitely a link? There's definitely a link. Where it come from first, maybe we don't know. We don't know, and we never know. But I think what's one of the important things that come out of today's chat is that you mentioned that some people with ADHD don't see the relevance or the benefit of talking or going to a counsellor. So maybe we could end on, what would your advice be to somebody who's watching or listening to this who feels like that?
Right, okay. In a nutshell, therapy comes in many different guises. Okay, for some people, it is about sitting in a room in front of an impartial witness who's never going to judge them and is going to hold them confidentially and letting them explore everything that's going on for them. Okay. Other people, they might find therapy in going out for a run, cold water swimming, going dancing, you know, you name it. That may be their place of therapy, and that is fabulous. And if that's working for someone with ADHD, you carry on doing it, all the healthy stuff you can. If you got to a place where you're still struggling with procrastination, feeling less than, it's knocking your self-esteem, it's knocking your confidence, you're socially withdrawing, then please find the courage to start to talk about this. For sure. Shop around, find the right therapist to work with, talk to a few different therapists on the phone. It may not be the answer for you. Therapy may not be enough to help you find a new way of coping with ADHD. It might be the beginning where you start to find your courage and you find your voice to tell your story. And then you find this fire in your belly where you want to start fighting for yourself a bit more. And then that helps you go on to get perhaps a formal assessment or go back to your GP. But I think that's really key, you know, so I hate using the word empowered, but I can't think of another one on the spot, you know, to feel empowered, to talk out for yourself, to get help, to find someone in a professional capacity beyond a therapist who can help you.
This is it. And sometimes I'm thinking that if you voice it, you might think that the other person thinks you're a bit mad when you start telling them how you think, but that's not the case, is it?
No, not at all. Not at all.
No, because that's sometimes is an issue why people don't talk, because you don't, you know, like you're even told that sometimes as a kid, you know, God, people could look inside your head. Do you know what I mean?
Yes.
That sort of comment, you'd be like, well, actually, no one's looking inside my head then. But the reality is, you need to get it out.
You do.
You need to talk. So as much as the cold water therapy is fantastic, running's fantastic, going to the gym's fantastic, all that is wicked,
isn't it?
But you need to talk.
Yes, you do need to talk. There's one other thing I'm desperate to say.
Go on, say it. No one's got
Otherwise, I'll feel really less than after this. So forgive me, but I don't want to open a huge can of worms. But I just feel it holds relevance and it should be spoken of. Some of the people I've worked with, some of my clients I've worked with who found the courage to go and talk to, for example, a GP to start a whole process of getting a formal assessment have struggled.
Okay. Yep.
I've heard of comments back where they've been told, well, I'll tell you what, sort your drinking out. And
then we'll look at it.
Then we'll look at your ADHD.
Okay. Yeah, that's not helpful.
Not helpful.
No.
Especially of what we're now talking about.
Of course, yeah.
You know, in very layman terms, we're talking about, you know, the link between ADHD and addiction. So that's not helpful. There's also, I think, a problem where young people, they might have had all the support they needed in school throughout childhood and adolescence, and then they've got to transition into adulthood and the real world beyond school. And the services might be interrupted.
Okay.
I've heard of one situation where a young man was told, well, you don't need your ADHD medication anymore because you're an adult.
Really?
Yeah.
Was that mean it just went then overnight?
Well, exactly, it didn't.
No.
And he's now got a serious coke addiction.
Okay. Yeah, that makes sense. Yeah. Because the coke is calming him down.
Of course.
Yeah.
And I've heard other stories where an individual's been told, you just need to learn how to control yourself.
So let me ask you a question then. So am I right in thinking the message you might be giving is that if you are talking openly and honestly to someone like yourself or a counsellor, therapist, whatever it might be, you can then make your own decisions rather than being told what to do by a professional who might not have your best interests at heart?
Yes. And also, it's about building your self-belief.
Yeah,
being able to sit in front of someone and say, no, please don't tell me I need to learn how to control myself, because do you think I'll be sat in front of you right now if I knew that?
You know what I mean?
You know, I've exhausted every avenue.
Don't patronise me, please.
Yeah, and I'm fed up with doing the unhealthy stuff, so can you help me, please?
Yeah.
And if you can't, who else can?
Or who else can? And if you have that door closed in your face, you might not go and talk to someone else again.
Exactly. So that's my hope, maybe, that if you can find the courage to come into therapy, then by the time you leave therapy, you've got the energy to start
I get that.
beating the doors down
of course,
and fighting for yourself.
Yeah, because you're giving yourself that self-belief and a bit of confidence to and some self-worth.
Yes.
Wendy, thank you very much for coming in.
Oh, it's been a pleasure. Thank
Cheers.
you.
Thank you. Guys, I hope you're enjoying the Sober Stew podcast and the episode today. Listen, I'm asking for a massive favour here. If you like the show, you like the podcast, and you feel like you're getting relevant content from it, please like and subscribe and share the channel, yeah? The way I see this is the more people know about this channel, the more chance we've got of spreading the message of recovery. And that might change one person's life. And if we do, that's enough. But let's look at it in a different way. If we save one person's life, that's massive. Please like, share, subscribe. God bless.
Trying to be the best I could be and achieve my dreams. They ain't really been where I've been. They ain't seen what I seen. They ain't felt what I felt. And the smartest thing I done was reach out for help. Now I'm flying by myself.